Well, hello, everyone. Welcome back to another one of our video series. Today, I have two amazing doctors that I'll be speaking to, happen to be father and son, Doctors Tom and Mark McCawley. They are from South Florida, both periodontists, and we'll be talking about a topic that I know is near and dear to all of our hearts, something that has plagued everyone who's probably watching and listening to this at some point in our lives, and that's bad breath. And it's something that can really impact people's lives and make us feel self-conscious and lack confidence and even go as far as to not want to leave the house. And so we're going to talk about that today. But before we go there, I want to let father and son introduce each other. So I'm going to let Mark, I'm going to let you go first and introduce your amazing father, Tom McCawley.
All right. Well, this is Dr. Tom McCawley, and today, given our topic, I mean, it's great to be able to introduce him because he's actually been treating bad breath for 25, almost 30 years now. So he got into it at the forefront, and he's been able to see, the changes in the treatment and things like that. And now we've got, we've got something that's going to be far and away better than what could have been done 25 years ago. So this guy, he's seen it all, he's treated it all, and he's absolutely fantastic at it. And he's been in practice for a while. He's taught me everything I know, and I'm just happy to be a part of this. So that's Dr. Tom McCawley right here.
So this is Dr. Mark McCawley. Actually, he's taught me everything I know. He's a fabulous periodontist. He's board certified in perio, and he's done a lot to really understand how we can help people solve their bad breath problems, which, as we like to say, periodontal disease helps save your life, but bad breath treatment gives you your life back. Mm-hmm. All right? Because many people, when they have bad breath, won't even go out of the house. So it's an amazing treatment that we have.
Mm. So, and by the way, just since we were near the time, happy Father's Day to you, McCawley. Great dad, as well as a great periodontist. Yeah. So, all right, let's jump in. I think one of the things that I've talked to both of you about is kind of some of the common misconceptions around bad breath. So, Dr. Tom, I'm going to start with you. What's the spectrum on bad breath, and when would it make sense for people to obviously visit you guys versus not?
Well, there's two aspects of that question. One is be aware of the tremendous myths that are out there about bad breath. People think that bad breath comes from the stomach. No. They think it comes from the sinuses. No. They think many mouthwashes will help it. No. They think just brushing and flossing will help it. No. So there's a lot of myths out there about bad breath, right? And then, how will they know if they have bad breath? So that's a critical question. One is ask a significant other, do you have bad breath? And just ask them to tell you. Also, you can also lick the back of your hand and smell it, or you can scrape your tongue with a tongue scraper or a spoon and smell it, and you'll see if you have bad breath.
Yeah.
Mark, from your vantage point, what have you seen in terms of patients that have come in, percentage-wise to those that maybe think they have bad breath versus it being a real problem that needs some sort of solution that you guys provide?
I mean, we do see some people that think they have bad breath, but sometimes they don't. But there's a good percentage of people out there that legitimately do have bad breath. And if you've got someone that you trust that tells you, hey, you know what, maybe your breath smells, they actually tell you about it, then that's kind of third party verification that helps us figure out, is it a legitimate concern, or is it something that maybe it's something else socially that maybe makes you think you have bad breath. But luckily we've got ways to tell empirically, do you have bad breath or do you not? And honestly, that's the greatest thing, because, if you're concerned about it, come in, get checked. We can tell you scientifically, do you have bad breath or do you not have bad breath? So that'll at least put your mind at ease. If you think you do and you don't, good, that's great. If you think you do and you actually do, then we can treat it. And that's honestly a benefit. And, there aren't a whole lot of people that are able to actually treat bad breath successfully. And, we've been able to kind of use new techniques that are far and away better than what we used to be able to even use. And it's very, very successful. And it's great to be able to actually cure people of their bad breath.
So we feel so confident about our treatment that we guarantee a cure or people get their money back. So we can cure it virtually every time. And the thing that we have that's unique, almost nobody has, we have this gas chromatograph that comes from Japan. That's an expensive machine that measures the three main gases that cause bad breath: hydrogen sulfide, methylmercaptan, and dimethyl sulfide. All right, so hydrogen sulfide smells like rotten eggs, methylmercaptan smells like feces, and dimethyl sulfide smells like rotten cabbage. So we get a printout of exactly, this is somebody who had bad breath, severe bad breath, right? So we could get this printout and shows exactly in parts per billion how much bad breath you have. For example, hydrogen sulfide, anything over 112 parts per billion, people can smell. All right, and here's the same patient that we, after treatment, that all the they're well below the
threshold
level that people can smell. So that's what we see routinely. So we have scientific ways of doing this.
So let me ask you, let me walk through as a patient. So step one, as I've already heard you guys say, is I have a concern, whether I've been told by somebody or I've smelled it myself. I'm concerned enough to say, hey, I want to get this checked out. So then I come in and see you guys, I schedule an appointment, and you do this test to determine whether or not it's something that needs further concerns or not. Tell me about that procedure. So what is it to get those results? What happens?
Well, it's a procedure that's done, and first let's talk about what causes bad breath, because that's one of the main things. You have to get rid of the cause of bad breath in order to actually treat it. So as far as the cause, it's biofilm, it's bacteria. It's certain types of bacteria that can build up around your mouth and primarily the tongue and even the throat that need to be removed in that treatment. Because, if you picture your tongue like this, this is your tongue and your throat actually goes back down this way here. And the trick is you have to actually remove all the biofilm, even back to the throat. So that's something that's very, very difficult to do. And we've actually got patented instruments that are able to actually get back there, clean that out very, very successfully. And that's how we're able to get that biofilm reduction. There are also bacteria around the cheeks and the tongue and the teeth as well. And we will remove those as well. But most of the bad breath bacteria, it's actually on the tongue and even the throat. And you're not able to really get down there successfully on your own initially. And that's something that we're able to do. And it's very nice to be able to actually eliminate that.
So it's back here on the lingual tonsil. You can see the very back of the tongue.
Yeah.
So we use these patented instruments to clean it. In addition, we pioneered the use of the laser, which will further kill the bacteria. So almost nobody, we're the only other office in the world that has these instruments, and we're one of the only offices that uses laser to kill it. That's why we can guarantee a cure.
Does it hurt to first get the procedure to determine whether or not I have bad breath or not?
No,
Not at all.
There's no pain involved in the examination and the treatment itself. There's no pain as far as that goes either. So it's honestly it's a pain-free kind of situation here in order to get it gone. And that's that's something that'll kind of you don't have to worry about it if you're a patient coming in. You don't have to worry about something painful. It's not something you're going to have to get stabbed or dumbed or anything like that. So that's definitely a benefit as well.
It takes really 4 visits to totally eradicate all the bacteria that are living beneath the tongue and deep down in the tongue. The bacteria hide way down in the tongue into these. This is the tongue papilla. And they hide way down at the bottom there. So that's why we have spatial instruments that you can't get those out with a toothbrush. Cleaning the tongue with a toothbrush is like cleaning a shag rug with a broom. You just can't do it. That's why you need this sophisticated spatial treatment that we do.
Yeah, the special instruments will definitely that we use are able to actually get in there and actually get into those papilla to get the bacteria out, because brushing and even tongue scraping, it just gets the top layer right there. And, you can't even see back to where your throat is there. So you can't see it, you can't remove it, you don't. And that stuff builds up and then it causes that smell, those gases we were talking about. And that's kind of bad breath in a nutshell right there.
And so, Tom, you mentioned 4 visits to completely eradicate the bad breath. The aftercare part of that, is it intense at all? What's it like for the patient?
No, it's well, they continue to do what they do, before, but there's some additional things they do that take an extra maybe 2 minutes twice a day to maintain it. But you do need to do that, just like you do with any disease or anything else you have, even gum disease. You got to take care. You got to maintain it.
Yeah.
And but it's not hard. An extra 2 minutes twice a day.
Okay, and then after the 4 treatments, most of the time, as I've talked to you all before, it's gone, and people are happy as can be and thrilled. And there's this, you've seen literally people's lives changed. What if I feel like it's back for whatever reason, or I'm concerned that maybe it's not completely gone?
Well, some people will feel it's back because they go from other people are used to your bad breath and they'll still kind of react to you even when you don't have it. So it's extremely rare for it to come back. If it comes back, when you come back in, we'll do the same organoleptics and
the oral chroma, the
chroma test,
gastromatograph.
And
so that way we'll be able to actually
tell you
scientifically
is it this way or more. So we can tell you scientifically. There's no doubt.
Yeah, there's no questioning right there.
If it's back, we'll do some more treatment, but rarely does it come back. Although we do have patients who think it's back.
Right.
Now, if it's back, we'll continue some treatment at no additional charge. If it's not back, the fee for that examination is going to be $650 because it's not back.
Right. Yeah, sometimes it's in people's minds at that point, but for them to get validation from you all one last time that scientifically it is gone probably means something to them.
Right.
Yeah. Because I mean, it's true. You've got people that are kind of conditioned to react to you in a certain way. Every time for your entire life, if you get close to someone and they're anticipating getting that smell, and sometimes it can be, feet away, like 5-6 feet away, you can smell the breath. That's not, it's not super uncommon with some of these bad breath patients to have that kind of reach with that. So you've got people that are conditioned for that. So, it's going to take a while for them to kind of condition themselves that, oh, wait a minute, it's gone. And
and for you to condition yourself that it's gone.
Right? I know that's
you've
the
been
thing.
living with it. Tell us about the patient that you treated that was 7 years old.
Yeah, no, I had a patient who came back in. He's I think he's either late 60s, early 70s at this point. So he came in, and it was kind of touching because we were like, why haven't you sought treatment for this in the past? And he was like, I didn't know that you could treat it. And that was something that was, it was hugely impactful because, a lot of people are just going on with their lives. And, it's something that massively impacted his life, but, he just didn't know that there was a way to treat it. And it was also interesting because we asked, when was the first time you realized that you had bad breath? And he was like, I can remember on the playground when I was like, 7, 8 years old, the kids used to call me stinky breath. I'm not kidding. Yeah, he's been living for 60 plus years with bad breath, and he didn't know that there was treatment. So, you've got someone who for 60 years, people have been kind of conditioned to react, a certain way around you. It's going to take a while for them to be conditioned that, yeah, it's gone. And now I can interact with them in a different way. I can get closer, it's going to be something that's going to be a completely different interaction. And also, it's something where people have been conditioned, for 60 plus years that, hey, my breath stinks, this is how people are going to react to me. So again, you're going to have to retrain your mind too. So it kind of goes both ways with that. But, it's nice to be able to empirically tell, is it gone? Is it not gone? So, when you walk out of here after treatment, it's gone. And, you just have to maintain it like anything else. And it's going to stay gone. So that's nice to be able to do and be able to treat people so successfully like that.
That's why we say again, our bad breath treatment, the guaranteed cure, gives you your life back. Mm-hmm. This guy for over 60 years was known as stinky breath. So it really changed his life.
Yeah, man,
and his significant other was quite happy about it.
Mm-hmm.
That is such a powerful, that really is a powerful story. His entire life, not knowing that there was something he could do about it. And finally, and hopefully he gets another 30 to 40 years of, bad breath.
To enjoy it. I know. Now he gets to enjoy having nice, fresh breath. Yeah.
At age 7, he was known as stinky breath.
Yeah, that's terrible and sad. And so I'm glad you guys.
That's what we see with these people.
Yeah,
a lot.
And what I've learned from you guys too is the people that are cases like this, obviously, that you need to treat can't mask it with gum or teeth brushing or mouthwash or anything. It's just there.
He's tried all those,
No, you think these people haven't tried that before? No, this is something that really affects them. And for instance, the same patient we were talking about, he kept mints and gum and stuff, and he'd constantly, every hour or so, he'd be popping mints and gum, but it only masks it because, believe it or not, not having bad breath doesn't mean you have fresh breath. It means you have no breath. Like literally, you won't smell anything when someone exhales in your nose, basically. So, the constant mints and stuff that just masks it. It just kind of gives it a minty mixed with whatever the heck else was in there kind of smell. And it goes away very, very quickly, and it's back to the same thing. We're able to get it down to basically just no breath. No smell coming out at all. That's our goal. And that's when we know we've been successful there.
So I have 2 more questions for you guys, a little bit different, a little more lifestyle questions, but and I want to ask those. I think other people would be interested in those answers as well. Before I ask those, I know there's someone, maybe a couple of people who are sitting maybe in Miami, maybe in Fort Lauderdale, or maybe somewhere else in South Florida and saying, Okay. You got me. This is something I'd really like to pursue. What would be the best way for them to get in touch with you guys?
Well, I mean, first things first, check out our website, McCawley.com. That's a great place to start. There's a lot of information on that website. Also give us a call. I mean, 954-522-3228. That is going to be all our front desk. They are very knowledgeable on the topic, so they can answer a lot of those questions for you. And I mean, make an appointment. That's going to be the only way to really know, do I have bad breath or do I not? Because we're able to actually get you in, test you, and then we're able to see, if it is there, then we're able to treat it as well. So that's going to be something that's going to be very important. And we're located in South Florida, basically the heart of South Florida, Fort Lauderdale, downtown. So it's centrally located. Anywhere in South Florida, you can get to us fairly easily. And then, even people from out of town, we've gotten people from all over the state and even all over the country. So, don't even have to limit yourself as far as that goes.
I had a patient fly in from Hawaii, actually.
Mm-hmm.
Wow.
So the first exam is a sophisticated exam where we do all these spatial tests. It takes about 2 hours. We'll also diagnose if you have gum disease or if you have any significant cavities and take x-rays. So it's a really comprehensive exam, like you've never seen before, to get to the bottom of any dental problem, but focusing primarily on your bad breath.
Yeah. So we focus on the bad breath and also any other underlying dental issues. We can diagnose those as well, because even something like like a failing cavity or something like that, if you've got a rotten tooth, that can contribute to bad breath as well. I mean, most of it comes from the tongue and elsewhere as well, as far as the bacteria. But if you've got a tooth legitimately going bad and abscessing, that can contribute as well. So we want to be able to diagnose everything, and that takes some time. And there's a lot of tests involved with what we do.
And we'll check for gum disease, and we check with the microscope to see if you have any of the bacteria that are associated with bad breath or that are associated with gum disease. And so we help you get rid of those bacteria in addition, the bacteria between the teeth.
Yeah.
Okay, my final two questions for you. Mark, I'm going to start with you on this one, but is there anything that we can do at home to help with bad breath that we haven't already talked about?
I mean, tongue scraping is going to be one of the better things that you can do as far as just kind of mitigating that. Again, if it's, in the very severe case, you got to come in and you got to get treatment. But just for the regular person, not that severe kind of thing, you can kind of mitigate it somewhat with tongue scraping and tongue brushing and using different antiseptics and things like that to be able to kind of beat it down. But at the end of the day, if it's, you can only get so deep around the tongue and the rest of the mouth as well. And in a lot of these cases, you're going to need some more treatment and above and beyond that.
Okay. And then Tom, this is the probably the most difficult question of the afternoon, but you have somebody in your life and you want to tell them they got bad breath. Any words of advice on how to do that?
Well, that is the critical question. But what we say is one of the things you can do is you can offer them a mint, all right, or a piece of gum. And that may bring up the question, why? Give it to them. Why do you do that? Well, you can ask them the question, have you noticed that any problems with your breath? All right. And then say, well, yes or no. Say, well, you can be gentle. Say, I've noticed that your breath, don't say it's bad, say your breath is a little off. So, but the good news now, see, in the past, when you did that, people had nothing they could do. So you just gave them a problem for which they had no solution. They would then clean their teeth a lot, brush their teeth a lot, brush their tongue a lot, still had bad breath.
There, yeah.
So now you can say, however, I know a place you can go that will guarantee you a cure and you'll be free of bad breath for the rest of your life. How good is that? So we like to say, we're going to change the world one breath at a time.
That's great, you guys. Well, thank you both for taking the time. I know you are extremely busy. I know it firsthand, but to take the time to educate us a little bit on this issue that we all, again, have felt or faced or seen or have experienced in our lives. And some people who have gone, like that case you talked about, 50, 60 years with the problem and not knowing that they could do something about it. So we really appreciate the lives that you both are changing. And again, start at McCawley.com if you want to check out their website and get some more information. Till next time, thank you both. Thanks everybody for watching and listening, and we'll see you again real soon. Take care, everybody.
All right. Thank you so much.
Thank you.